Hi everyone, it's Dr. Tidman. Welcome to my channel. Thanks for stopping by for another of my brief research reviews. Every Monday, I try to post a review of a current research study on a given topic. I like to present the study elements, some of the study design, some of the results that the authors found, and I always post the original article in the description so you can review the article yourself. Please remember to subscribe to my channel and hit the like and the notifications so that you can be informed of my future video postings. Also, remember that these presentations are for informational and educational purposes only. Please consult your own medical team if you want to make any changes. I always like to tell people who may be new to my channel that I am a metabolic health practitioner, a university professor, and the director of clinical research for the Colorado Parkinson Foundation. I also run a telehealth practice. I've been conducting research in Parkinson's disease since 2018 and in osteoporosis since 2023. Be sure to comment if you have a question or if you found this content useful or educational. Today I'll be reviewing a study by Sinchione, I'm sure that I'm mutilating that name et al., which is entitled Effects of a Mixed Ketogenic Diet in Overweight and Obese Women with Polycystic Ovarian Syndrome. I'm going to call it PCOS. As a metabolic health practitioner, my focus is always on providing some practical application to your daily life. And I've seen many patients in my private practice with PCOS and infertility problems, and also obesity and metabolic syndrome. So at the end of this research review, I'll give you my common and typical tips and takeaways, tips for daily living, I like to call them, that you've probably seen on some of my other research videos. Now, on to our study. So our objectives today are to introduce the study and the topic, discuss the design that the authors used, discuss some of the data and variables that they reviewed, discuss the results that they found and their conclusions, and then of course Dr. Tidman's final tips and takeaways at the end. So what is PCOS? It's a common endocrine disorder. It can be characterized by symptoms of hirsutism, which is an overgrowth of facial hair, and ovulation, which means ovulation has ceased and women rarely have a menstrual period, and multiple cysts on the ovaries. We frequently and consistently see that women with PCOS have insulin resistance, they have poor lipid control or dyslipidemia, and obesity is quite common in these women. PCOS, as a result of insulin resistance, also places these women at significant risk for the development of cardiovascular disease, other metabolic health problems like type 2 diabetes and metabolic syndrome, high blood pressure, low HDL, high triglycerides, high glucose. These are the characteristics of metabolic syndrome. The researchers found a huge relationship between central obesity, and that is a large waist circumference, and the development of insulin resistance. excess adipose tissue, fat tissue, and the fact that these adipocytes or fat cells are dysregulated, their functions are greatly impaired or abnormal, seem to add to the complications in PCOS. The most commonly prescribed intervention for PCOS is lifestyle correction through diet and physical activity. The authors investigated the beneficial effects of a ketogenic diet in 17 women with obesity and PCOS. And of course, 17 is a very small group. So, take that into consideration as I review this research. The authors found that approximately 75% of women with PCOS are also overweight or obese or have central obesity, and that is a waist measurement over 35 inches. We know that the presence of obesity leads to an elevation of something called inflammatory cytokines, and these are molecules which cause a great amount of inflammation in all of the tissues and organ systems in the body. This also promotes a very low level or low grade chronic inflammation in the body. The authors discussed that carbohydrate intake, especially those carbohydrates with high glycemic index and glycemic load, that is, carbohydrates that elevate your blood glucose quickly and substantially, can stimulate a rapid increase in glucose levels and a rapid increase in sustained insulin levels. Remember that insulin is the hormone that regulates your blood glucose. So as your glucose rises, your pancreas that produces insulin needs to crank out more insulin to control your blood glucose. This sustained and chronic elevation of insulin levels in the blood leads to insulin resistance, and that is, insulin kind of loses its effect in some of your cells in your body. So the methods the researchers used for these 17 women is they had 45 days in the study. At baseline, they assessed their medical history, their gynecological history, they evaluated their menstrual status, whether they hadn't had a period in a while, or whether their periods were dysregulated or irregular. They evaluated their nutritional status, their body composition, and then they did their biomarkers. They redid these assessments 45 days later. They recommended that these 17 women consume a maximum of 30 grams per day of carbohydrates. They actually prescribed a high protein diet. 30 to 40% of their daily calories needed to come from protein sources. And then they prescribed fats at 30 to 40 grams per day, which is not necessarily high fat, more moderate fat intake. Now, the interesting thing about this study is they calorie restricted their 17 women to only 600 calories a day. Now, keep in mind, these women also had obesity. So the researchers wanted to use a ketogenic approach, but also a calorie restricted approach. So over the 45 days, there was an average weight loss of 9.4 kilograms or about 20 pounds in 45 days. Pretty good weight loss in this group. They lost 4.5% of their body fat, or they estimated using bioimpedance imaging that they lost about 17 pounds of fat mass in 45 days. Their waist measurements decreased on average of about 4 inches. Their average ketones ranged about 1.7 millimolar. And we remember from other research reviews that I've done that nutritional ketosis begins at 0.5 millimolar. So this group was well into nutritional ketosis and sustained moderate levels of ketosis throughout the 45 days. They found that their average glucose levels reduced by 10 milligrams per deciliter, which is really a pretty substantial drop, and that their average blood insulin levels reduced by 12 UIUs per liter. Their triglycerides dropped to an average of 70 milligrams per deciliter, which is, from a metabolic health perspective, a desirable triglyceride level. And their HDL increased to an average of 65 milligrams per deciliter, which in metabolic health, we like to see HDL above 50 milligrams per deciliter. So this definitely achieved that result. Even with the higher protein in this diet, it's interesting that they were still able to maintain a moderate level of nutritional ketosis. So the results, the authors found a reduction in the production of androgens. So androgens are things that cause the hirsutism, and that is an overproduction of male hormones in a female body with an overproduction of facial hair. They found a considerable reduction of fat mass, and that this reduction in fat mass seemed to be tied to some elevations in natural estrogens. It also resulted in greater sensitivity of the fat cells and that decrease of fat cell abnormal metabolism. As far as fertility goes, they found an improvement of luteinizing hormone and follicle stimulating hormone. And there's a desirable ratio that these two hormones should sustain for fertility and ovulation. Of course, they showed that these women were able to achieve and maintain nutritional ketosis, which improved their hormone levels, their insulin sensitivity, and something called a HOMA-IR index, which is a calculated value that indicates the presence of insulin resistance. So of the 17 women, 12 of them regulated their menstrual cycles for the first time. That's a pretty substantial percentage. 5 of the 17 women restored cycles that they had not had in a while. And 5 of the 17 women became pregnant. So fertility was enhanced in that group. So the author's conclusion said it best, so I'm going to read from the study article. Therefore, a mixed ketogenic medical diet, and when I say mixed, that means that they had a higher protein percentage than a common or typical ketogenic diet, for only 45 days, intervening electively and specifically on some of the key pathophysiological symptoms that determine PCOS, such as insulin resistance, hyperinsulinemia, which is high insulin, hyperandrogenism, which is that high levels of androgens, and increase the luteinizing hormone and the ratio of luteinizing hormone to follicle stimulating hormone for fertility. And they found that this approach represented an adjuvant medical therapy in the management of PCOS. And adjuvant usually means in combination, perhaps, with medications and other interventions. And it was completely free of some of the adverse effects that are produced by drug therapy alone. They also found a reduced risk of developing or sustaining or maintaining obesity, metabolic syndrome, and diabetes. They found that the use of a caloric restriction ketogenic approach in a short period represents a strong protocol for improvements in the symptoms of obesity and PCOS. So, you would expect that Dr. Tidman's tips and takeaways are similar to what I've shared in other research reviews. So I would suggest that you adopt a ketogenic diet plan with 60 to 70% of your daily intake from fat sources, 20 to 25% from protein sources, and carbohydrates below 5%. Now, the study I reviewed, they used a higher protein content than this. You certainly could go up to 30% on your protein intake, especially if you're doing some weight training, some resistance training or powerlifting. And your goal is to create and produce enhanced muscle. I still recommend that you add daily MCT or coconut oil from 3 to 5 tablespoons a day. Test your blood glucose and ketone levels every morning. Implement intermittent fasting regimens, which can be 2 meals a day with a 16-hour fast, or 1 meal a day with a 20 to 23-hour fast. I always recommend that my patients exercise 3 to 5 times per week with a combination of aerobic and resistance training. And you should address your microbiome through the proper use of specific probiotics and fermented foods. Check out my YouTube channel and the video about probiotics and the gut microbiome. I go over the functions of the microbiome and even do a cooking demonstration and show you how to make homemade medical grade probiotic fermented dairy. I also recommend, especially in my patients with PCOS, that they reduce their stress levels, that they develop good sleep hygiene, that they eliminate inflammatory foods and additives from their diet, including grains, processed foods, sugary juices, and sodas, that they get regular sunshine or add a vitamin D supplement 2,000 IUs per day minimum to get vitamin D levels up above 50. I also recommend they join a PCOS or fertility support group, and there are many groups available that are free and online. This is the reference for the review article on the effects of a mixed ketogenic diet in overweight and obese women with polycystic ovary syndrome. Thank you for stopping by and viewing another one of my brief research reviews. If you have any questions, feel free to email me at melanietidman@gmail.com. And check out my other videos on my channel. Thanks again for stopping by. Remember to subscribe to my channel, like, and hit the notification bell. I'll see you next Monday with another research review. Take care and be well.